Hi, my name is Dr. Salahuddin Abubakar, your friendly neighborhood dentist at Pearl Dental Clinic in Business Bay. Today I'm going to talk about Invisalign and can Invisalign done on patients who still has their milk tooth remaining. So I'm talking about adults who has this milk tooth that is still in its place and which has not been replaced by a permanent tooth. Now we have seen in our practice many times that we have patients with this kind of scenario. Usually the milk tooth falls off at the age of between say 12 to 15 years old, but sometimes one or two milk tooth still remains. So when this kind of patients come in, our first protocol would be to take an X-ray to identify if there is a permanent tooth right above this milk tooth. If there is one, then we try to force erupt the permanent tooth into its actual position. So we advise our patients to have their milk tooth removed and then go for braces or with Invisalign combined with some orthodontic appliance to move this permanent tooth into its actual position. Now, what if the permanent tooth is completely missing or it is placed highly up? In this case, it will be impossible to pull the permanent tooth into its place. So we tell our patients that there is a possibility of this milk tooth falling off during the Invisalign treatment or the braces treatment. So in this case, it can be a big challenge, especially if it is right in the front. And this is where Invisalign actually actually has an upper hand over the braces. Now with Invisalign, if the milk tooth were to fall off, we can actually paint the missing tooth into the Invisalign, and as long as the patient is wearing these aligners, it will never show, or it will not show that there is a missing tooth. With the braces, however, there is a technique. We can have an artificial tooth in its place, and then, but the problem is like we will have to keep modifying them once in a while as the tooth kind of moves in its own. So I hope that was useful. Like, share, and comment for more.